Hi everyone. If you're here watching this video, I assume it's not for entertainment. You're probably not having a good time, and you have my sympathy. This is what I'm going through right now. I'm posting this video the same day that I recorded it. As you can see from this picture here, my left foot does not look great. This dark shade of the skin is one of the classic indicators of CRPS. It's nerves going haywire and not managing blood flow correctly, which is why managing your blood circulation is very important in this process and why warm water helps. Just a disclaimer, I am not a doctor or certified in any type of medical profession or therapy. This is just what I have learned and what I have found works for me. The idea here is that you're using the warm water to help your blood circulation while also using the stimulation of the massaging shower head to stimulate the nerves. And the idea there is to retrain those nerves to work properly. Depending on the severity of your case, what you're able to start out with and tolerate is going to vary. If you have very mild symptoms, you could probably handle a pretty strong jet of water. If you have severe symptoms, you might not be able to use much water pressure at all. A person that's really suffering is probably going to be starting out with something closer to like a feather duster. They won't be able to handle touch from anything harsher than that. And what I found you want to do with this is to stimulate the nerves up to the point of what they are able to handle, but do not go any further. When I hit that point that my nerves freak out, it seems like that's an automatic trigger for additional inflammation and additional symptoms. Likewise, if I do nothing, if I keep the foot, wrapped up in a boot and never move it, the same thing's going to happen. The nerves, in my opinion, the nerves have like lost their sense of zero. So if you aren't using the nerves, they're not going to get better. And that's why you have to use them up to the threshold of what they're able to handle, while not, reaching that tipping point that you trigger more inflammation. You've probably noticed that I am spraying both feet with the shower head, and there's a reason for that. I have no scientific proof of this, but I believe that at the neurological level, your brain needs to feel what the stimulation should feel like, and that's what your good limb is going to be sending to the brain. When I'm reading about this, they call that a mirroring effect, and you're welcome to do your own reading on that subject. You'll also notice I'm moving my toes around a lot. I got this from Frank Ng. You can search his videos here as well. I highly recommend his exercises. If you've gotten CRPS from plantar fasciitis like I did, you probably had some form of a mild rupture, so you don't want to push those exercises very hard. At least I've found that it's really easy to go too far with those, so I am only doing them gently. Right now I'm spraying my intense trigger point there. That right side of my toe is brutal. I can barely apply pressure to that point on the foot. The rest of the foot is more just generally sensitive, but not nearly to that level. So in my case, I'm treating what's called type 1 CRPS. That means it was initiated by a mild trauma, usually to soft tissue. There was no, direct injury to the nerve, at least that is known. And that is generally the majority of cases out there, um, and also your best chance of recovering. I think I'm personally at a higher risk right now because this is my second tour with CRPS. I originally hurt the foot back in March, so that would be about 8 months ago. And I had recovered to the point that I was walking again, but limited. And unfortunately, one day while I was walking, it shredded on me again, and the symptoms started all over, back to square one. And this time it feels like the symptoms are a little bit deeper rooted, so I'm going to be doing this type of therapy as much as I possibly can to keep these symptoms calmed down and hopefully recover. You're going to notice as you do these exercises, your foot will start out sensitive, and then the sensations will die down as you get used to it. That's exactly what you want to be going for. You are going to find, however, that there is only so much the nerves will calm down in one treatment, and that's why I generally only do this for about 5 minutes, sometimes as much as 10, but rarely more than that. Even 1 or 2 minutes of this treatment can make a big difference. Having said that, doing more never hurts. So there may be times when you're really flared up that an hour or more of this might be beneficial. If you got a jacuzzi tub, you can use the jets as well. I like this method because I can just sit down on the side of the tub, turn the water on, and do the exercise for 5 minutes. It's a lot easier to do that 3 or 4 times a day than it is to fill up the bathtub. And as you get better, there are add-ons you can do, such as brushes, which I'll put a video of that up here as well. Anyway, hope you found this helpful, and wish you the best in health and life. Thanks.